Hello and welcome. Today we're diving deep into the world of eye health to explore a condition known as follicular conjunctivitis. We'll uncover what it is, what causes it, how it's diagnosed, and what you can do about it. So, let's get started. Follicular conjunctivitis, as the name suggests, is characterized by the presence of follicles on the conjunctiva, the clear membrane that covers the white part of your eye and the inner surface of your eyelids. These follicles are small, raised bumps composed of lymphocytes and other immune cells. The most common culprits behind follicular conjunctivitis are viral infections, particularly adenoviruses. However, other causes include certain bacterial infections like Chlamydia trachomatis, molluscum contagiosum virus, and even reactions to topical medications or irritants. Sometimes the exact cause remains unknown. To understand follicular conjunctivitis, it's important to understand how the immune system responds to infections or irritants in the conjunctiva. When a virus, bacteria, or other irritant invades the conjunctiva, the immune system kicks into gear. Lymphocytes, a type of white blood cell, migrate to the site of infection. These lymphocytes then cluster together, forming the characteristic follicles we see in follicular conjunctivitis. Unlike papillae, which have a central blood vessel, follicles lack this central vascular core, giving them a distinct appearance under magnification. Follicular conjunctivitis is a relatively common eye condition. Viral causes are highly contagious, which means outbreaks can occur, especially in crowded environments like schools or workplaces. Trachoma, caused by Chlamydia trachomatis, is a major cause of infectious blindness worldwide, particularly in areas with poor sanitation and hygiene. The prevalence of other causes varies depending on factors like geographic location, hygiene practices, and access to healthcare. The hallmark symptom of follicular conjunctivitis is, of course, the presence of follicles on the conjunctiva. These follicles typically appear as small, grayish, white or translucent bumps. Other common symptoms include redness of the eye, a gritty or foreign body sensation, tearing or watery discharge, mild itching, and sometimes sensitivity to light. Vision is usually not significantly affected. In cases caused by certain viruses, you might also experience systemic symptoms like a cold or sore throat. Diagnosing follicular conjunctivitis usually involves a thorough eye examination by an ophthalmologist or optometrist. The doctor will use a slit lamp, a special microscope with a bright light, to closely examine the conjunctiva and identify the follicles. They may also avert the eyelids to check for follicles in the fornices, the folds where the conjunctiva meets the eyelids. In some cases, the doctor may collect a sample of conjunctival cells for laboratory testing to identify the specific cause of the infection, especially if bacterial or chlamydial infection is suspected. Follicular conjunctivitis can be broadly classified based on the underlying cause. Viral follicular conjunctivitis is usually self-limiting. Bacterial follicular conjunctivitis requires topical antibiotic treatment. Trachoma, a specific type of bacterial follicular conjunctivitis caused by Chlamydia trachomatis, has its own distinct classification system based on the World Health Organization's SAF strategy: surgery, antibiotics, facial cleanliness, and environmental improvement. Furthermore, follicular conjunctivitis may be further categorized depending upon severity levels such as mild, moderate, or severe. Treatment for follicular conjunctivitis depends on the underlying cause. For viral infections, treatment is usually supportive, focusing on alleviating symptoms with artificial tears and cool compresses. Good hygiene practices, such as frequent hand washing, are also essential to prevent the spread of the infection. Bacterial infections require topical antibiotic eye drops or ointments. Trachoma is treated with oral antibiotics, typically azithromycin. In cases caused by topical medications, discontinuing the medication is usually sufficient. It's essential to follow your doctor's instructions carefully and complete the full course of treatment, even if your symptoms improve. The best way to prevent follicular conjunctivitis is to practice good hygiene. Wash your hands frequently with soap and water, especially after touching your eyes or face. Avoid touching your eyes unnecessarily and don't share towels, washcloths, or eye makeup with others. If you wear contact lenses, clean them regularly and properly, and replace them as recommended by your eye doctor. If you have a viral infection, stay home from school or work to prevent spreading the infection to others. The prognosis for follicular conjunctivitis is generally good, especially when it's caused by a viral infection. Most cases resolve on their own within a few weeks. Bacterial infections typically clear up quickly with antibiotic treatment. Trachoma, if left untreated, can lead to serious complications, including blindness, but early diagnosis and treatment can prevent vision loss. Recent research is focused on developing more effective treatments for viral conjunctivitis and finding new ways to prevent the spread of trachoma. Scientists are also exploring the role of the immune system in the development of follicular conjunctivitis, and identifying new targets for therapeutic intervention.